Did you know that something you do every single day could be silently destroying your manhood? What if I told you that your morning shower, yes, that private ritual you've performed thousands of times, might be the very reason your performance in the bedroom isn't what it used to be? Most men over 50 are making 4 critical mistakes in the shower that directly impact blood flow to their most vital organ. Today, I'm going to reveal these hidden saboteurs and show you exactly how to reverse the damage. This information is so powerful, yet so simple, that you'll wonder why no doctor has ever told you before. Hello, I'm Dr. Grace Hill, specialist in male health and vitality. If you're looking for reliable, no-nonsense solutions to regain your potency and confidence, subscribe to this channel right now, so you never miss any content that could change your intimate life forever. Today's video might be the most important one you'll ever watch if you're over 50 and concerned about your performance. Few men realize that the bathroom is where many intimate problems begin. The shower, a place meant for cleanliness and rejuvenation, can actually become the starting point of a downward spiral for your sexual health after 50. What happens in those 10 to 15 minutes affects your circulation, hormone levels, and nerve sensitivity for hours afterward. Most concerning is that these effects accumulate over time, creating a silent decline in your masculine vitality that most men simply attribute to getting older. But here's what few men know. This decline isn't inevitable. In fact, with the right adjustments to your daily routine, your shower can become a powerful tool for enhancing blood flow, supporting healthy testosterone levels, and maintaining the sensitivity needed for satisfying intimate encounters. Research from urological institutes shows that men who modify these simple daily habits report up to 70% improvement in erectile quality within just 3 weeks. The science behind this is straightforward. Everything from water temperature to the products you use creates a cascade of physiological responses that directly impact your performance. Before we dive into the specific mistakes, I want you to understand something crucial. Your body's vascular system, the network of blood vessels responsible for delivering blood where it's needed most during intimate moments, is highly responsive to external stimuli. And few stimuli are as regular and intense as your daily shower routine. Let's examine the 4 worst mistakes and the simple corrections that can transform your intimate health. The first, and perhaps most damaging mistake, occurs before you even reach for the soap. It's the scalding hot shower that most men over 50 indulge in each morning. While that steaming hot water might feel wonderful on aching muscles, it's creating a disaster for your circulatory system, particularly the delicate blood vessels responsible for erectile function. When you expose your body to excessive heat, especially in the genital region, several problematic things occur. First, the heat causes vasodilation throughout your body, temporarily widening blood vessels. While this sounds beneficial, it actually creates a rebound effect once you exit the shower. As your body cools, those vessels constrict, often more tightly than before, reducing blood flow to critical areas. Even more concerning is what happens to your testicular function. The testicles hang outside the body for a reason. They require a temperature approximately 2 degrees lower than your core body temperature to produce testosterone efficiently. By subjecting them to hot water for extended periods, you're effectively suppressing testosterone production, the very hormone responsible for your libido and erectile function. Studies show that men who take hot showers for more than 10 minutes daily have measurably lower testosterone levels than those who maintain moderate temperatures or include cold exposure in their routine. The solution isn't to take ice-cold showers, though we'll discuss the benefits of cold exposure shortly. Instead, simply reduce your shower temperature to comfortably warm rather than hot, and limit your shower time to under 10 minutes. This simple adjustment preserves testicular function while still providing the cleansing benefits you need. Let's explore more deeply how temperature affects your erectile function. What few men realize is that excessive heat doesn't just temporarily impact performance, it can create lasting damage to the vascular mechanisms responsible for erections. The erectile tissue in the penis, called corpus cavernosum, depends on nitric oxide production to trigger the relaxation of smooth muscle, allowing blood to flow in and create firmness. Research has shown that regular exposure to high temperatures can reduce nitric oxide synthase activity, the enzyme responsible for producing this crucial molecule. Beyond the immediate effects, hot water strips your skin of natural oils, including in the genital region. This leads to dryness and reduced sensitivity over time, making it more difficult to respond to stimulation. Many men mistakenly blame age for this diminished sensation when their daily habits are the actual culprit. Perhaps most alarming is the effect on pelvic floor circulation. As you age, the network of blood vessels supporting erectile function naturally becomes less efficient. Hot showers accelerate this process by creating inflammation in these delicate tissues, leading to what urologists call vascular aging. Essentially, your erectile blood vessels functioning as if they're decades older than they actually are. Men who maintain moderate water temperatures report not just better erectile function, but improved urinary health as well, a common concern for men over 50 dealing with prostate changes. The connection is clear. Temperature management in your daily shower directly impacts your overall pelvic health. Before we continue with the next critical shower mistake, I want to mention something important for men who need that extra support. I'm going to recommend 2 revolutionary supplements for better erections, healthy testosterone support, and prostate comfort, the ones I trust for my patients. Check the comments below for the exact products and links for those who want to consider them. The second major shower mistake occurs when you reach for that commercial body wash or soap. Most men don't realize that the products they're using contain chemical compounds that directly interfere with hormonal balance. The most problematic ingredients are parabens, phthalates, and sodium lauryl sulfate, chemicals found in over 80% of commercial body washes. These compounds are known as endocrine disruptors because they mimic estrogen in the male body, effectively lowering testosterone levels with regular exposure. A landmark study published in the Journal of Clinical Endocrinology found that men with high levels of these chemicals in their bloodstream had testosterone levels averaging 17% lower than men who avoided these ingredients. Even more concerning, these chemicals can absorb directly through the skin, with the genital area being particularly vulnerable due to its thinner skin barrier. What few men know is that these ingredients don't just wash away, they accumulate in fatty tissues over time, creating a compounding negative effect on your hormonal health. This is especially problematic for men over 50 who already face natural testosterone decline. The solution is remarkably simple. Switch to natural plant-based soaps that are free from these harmful chemicals. Look for products containing essential oils like eucalyptus, pine, or cedar, which not only avoid hormonal disruption, but may actually support healthy testosterone levels through aromatherapy pathways. Be particularly careful about masculine-scented products that promise vigor or energy. These often contain the highest levels of synthetic fragrances, which are among the worst endocrine disruptors. Natural doesn't mean ineffective. Quite the opposite when it comes to preserving your masculine vitality. Now that we've identified 2 major mistakes, let me share a powerful technique you can implement tomorrow morning to begin restoring healthy blood flow. This method takes just 3 minutes and works by triggering what urologists call microcirculatory stimulation, essentially training the small blood vessels in your pelvic region to dilate and contract efficiently. Here's how to perform it. After washing with your natural soap at a moderate temperature, reduce the water temperature until it's cool but not uncomfortable. Now, direct the water stream at your lower abdomen, upper thighs, and lower back area for 30 seconds. Then increase the temperature to warm, not hot, for another 30 seconds. Repeat this cycle 3 times, always ending with the cooler temperature. This contrast therapy has been shown to increase nitric oxide production by up to 40% and improve microcirculation in the pelvic region. Men who practice this technique regularly report firmer morning erections within just 1 week. What's happening physiologically is fascinating. The temperature variations trigger a process called vascular training, where blood vessels learn to respond more efficiently to dilate and constrict. This is exactly the mechanism that must function properly for strong, sustainable erections. The beauty of this technique is its simplicity. No special equipment, no medications, and no embarrassing conversations with your doctor. Just a simple adjustment to something you're already doing every day, with potentially life-changing benefits for your intimate health. The third critical mistake occurs immediately after you step out of the shower. 87% of men over 50 make the error of vigorously rubbing themselves dry with a towel, particularly in the genital area. This seemingly innocent habit causes microtrauma to the delicate tissues and nerve endings essential for sexual response. Over time, this rough treatment leads to keratinization, a thickening of the skin that significantly reduces sensitivity. Even more problematic is how this affects the dardos muscle, a specialized tissue in the scrotum that controls temperature regulation of the testicles. Rough drying creates tension in this muscle, interfering with its ability to properly position the testicles for optimal testosterone production. What few men realize is that how you dry yourself affects hormone release for hours afterward. Rough treatment triggers a minor stress response, releasing cortisol, a hormone that directly opposes testosterone production. This creates a hormonal environment less conducive to sexual function and desire. The solution is straightforward. Pat yourself dry gently, particularly in sensitive areas. Take an extra 30 seconds to ensure you're completely dry, especially in skin folds and the groin area, as moisture left behind can lead to fungal issues that further complicate intimate health. This gentle approach preserves nerve sensitivity, prevents microtrauma, and avoids triggering the stress response that can inhibit testosterone production. It's a small change that yields significant benefits for your sexual well-being. European urologists have been at the forefront of researching non-pharmaceutical approaches to maintaining erectile function. One technique gaining significant clinical support is the cold contrast method, an enhanced version of the technique I mentioned earlier. This approach leverages the power of temperature variation more strategically. Here's how European specialists recommend implementing it. At the end of your regular shower, reduce the temperature until the water is cold, not painfully so, but definitely cool enough to feel invigorating. Allow this cold water to run over your lower abdomen, thighs, and lower back for 30 to 45 seconds. The physiological response is remarkable. This cold exposure triggers immediate vasoconstriction, followed by a powerful rebound vasodilation once you exit the shower. This rebound effect dramatically increases blood flow throughout the pelvic region, delivering oxygen and nutrients to erectile tissues while removing inflammatory compounds that may have accumulated. Beyond the immediate circulatory benefits, this cold exposure has been shown to increase testosterone production by up to 24% in some studies. The mechanism appears to be related to the activation of brown adipose tissue and improved testicular function through optimal temperature regulation. Men who incorporate this technique 3 to 4 times weekly report not just improved erectile quality, but also enhanced energy levels, better mood, and increased motivation, all hallmarks of optimal testosterone function. The most effective protocol involves 3 shower days with the cold contrast method, followed by 1 day using the more moderate approach described earlier. This prevents adaptation and maintains the potent hormonal response to the temperature variation. The fourth shower mistake extends beyond what we discussed about rough drying. It involves the actual towel you're using and the way you're using it. Most men use the same towel for their face, body, and genital area, often for several days without washing it. What you may not realize is that towels quickly become breeding grounds for bacteria and fungi. When you reuse these towels on your genital area, you're introducing potentially harmful microorganisms to this sensitive region. These can create inflammation, subtle infections, and even alter the natural pH of the skin, all factors that negatively impact blood flow and nerve function, crucial for sexual response. Even the material of your towel matters. Synthetic fibers and towels washed in harsh detergents can irritate sensitive skin, creating microscopic inflammation that compounds over time. This chronic, low-grade inflammation is particularly problematic for erectile tissue, which relies on pristine vascular function. The solution is twofold. First, use separate towels for your face, body, and genital area. Second, ensure you're using towels made from natural, breathable fibers like cotton or bamboo, and wash them in gentle, natural detergents free from harsh chemicals. Most importantly, replace your towels more frequently than you think necessary. Urologists recommend fresh towels every 2 to 3 uses to prevent the buildup of microorganisms that can affect intimate health. This attention to detail might seem excessive, but remember, it's these accumulated small habits that create either an environment for optimal sexual health or contribute to its decline. The healthier your skin microbiome remains, particularly in sensitive areas, the better your overall sexual function will be. After studying men who maintain remarkable sexual vitality well into their 70s, I've identified 5 common shower habits they all share. These aren't complicated techniques. They're simple practices that create powerful cumulative benefits. First, these men all practice temperature discipline. They avoid hot showers entirely, opting instead for warm water with periodic cold exposure. This maintains optimal testicular function and vascular health. Second, they use natural products exclusively. Their soaps, shampoos, and skincare items are free from endocrine-disrupting chemicals, preserving hormonal balance crucial for sexual function. Third, they incorporate mindfulness into their shower routine. Rather than rushing through it while mentally planning their day, they use this time to practice deep breathing and body awareness. This reduces stress hormones like cortisol that directly interfere with testosterone and erectile function. Fourth, they all implement some form of the contrast therapy we discussed, training their vascular system to respond efficiently, the exact same mechanism needed for strong erections. Finally, they prioritize post-shower skincare. They use natural moisturizers on their body and specialized products for the genital region that maintain skin health without disrupting natural oils or bacterial balance. What's most remarkable about these men isn't just their continued sexual function, but their confidence and vitality in all areas of life. The shower routine becomes a cornerstone habit that supports overall health, creating a positive cascade effect throughout their day. By implementing these 5 secrets, you're not just preserving sexual function, you're creating a foundation for overall vitality that affects everything from your energy levels to your confidence in intimate situations. If you found this information valuable, please take a moment to like this video and subscribe to the channel. The techniques I've shared today are just the beginning of what's possible for men who want to maintain or restore their full masculine potential. Click right now on the video appearing on your screen and keep discovering the secrets of male vitality after 60. Your health and performance deserve this attention. Remember, age is just a number. Your daily habits are what truly determine your vitality and performance.